We are now in a position to be able to immunize residents in their facilities. Now, this is a huge step forward in our efforts to protect these residents, to protect the staff, to protect the families of these residents. Having the ability to bring the Moderna vaccine to the bedside will make a massive difference in our ability to stop the spread. It also means that we can reach more remote communities where the impact of a COVID outbreak can be devastating. And it means that we can work to protect entire facilities at once, immunizing entire floors and facilities in one visit. Immunization is also quickly moving out to other congregate care settings and into the broader community of seniors, as Premier mentioned. Our first focus is on the most vulnerable, where we have seen the greatest impact throughout the pandemic. But we will rapidly move beyond that in the coming weeks as more vaccine arrives in the province. We set an aggressive target for the end of this year based on the supply that was expected at the time. The exact dates, the exact amounts of the vaccine we're receiving have shifted a bit in these first few weeks, as was only to be expected, but our commitment remains that we're getting the vaccine out to staff and to residents as fast as we receive it, given the complexity of handling the Pfizer vaccine in particular, the requirements for staff training, etc. AHS will be ramping up as shipments come in. And at the same time, we're seeing a sustained drop in new daily cases, with the result that active cases are now below 15,000. They peaked at just over 21,000 just a couple of weeks ago, so this is a real improvement. I know for some people it will raise the question, why are the numbers of people still dying still so high and even going up when cases are going down? So it's important to be clear. Deaths do typically lag new cases by a couple of weeks, so this is no contradiction. We are at a turning point in the pandemic where the decrease in new daily cases will soon lead to a decline in mortality and an easing of the burden on our hospitals, but only if we stick with it, especially through the New Year's holiday. So I want Albertans to be encouraged. We've slowed the pandemic and started to slowly roll it back.